This is in an annual report. It's called the gold standard measure of public satisfaction. The interesting thing and the most worrying thing is the greater percentage were actively dissatisfied with the NHS. This was a survey of 2,945 people showing a startling collapse in the public satisfaction with the NHS. Joining me now, Dr. Tony O'Sullivan, co-chair of Keep Our NHS Public and retired consultant paediatrician, joins me this afternoon. Good afternoon.
Good afternoon.
I'm very saddened by this. I'm not surprised. What do you think?
Well, I'm very saddened too. I gave my professional life to the NHS for 40 years. I think what is heartening, very heartening from the survey, which we should mention on top of the levels of dissatisfaction, which incidentally aren't just A&E and dentistry. It's right across the board. It's mental health, it's maternity, and it comes down to the same basic reasons, I suppose. But what I found heartening is that 90% of those answering the questionnaire believe in the NHS as a model and as a fair way of accessing healthcare for all, and that it should be funded by public taxation. And I think it was also important to note that 69% feel that not enough money has been spent on the NHS. I know you may challenge that, but 69% of the population in this survey, 72% say that there aren't enough staff. And when you hear stories
they're different though, aren't they? The amount of money we spend and the amount of staff are different points.
They are different points, and I would make different points about them, but they are both very pertinent, because if you hear stories of a woman giving birth and not having a midwife by their side, that is shocking. When you hear stories of people not being able to get hold of a GP when they need it, and so on. And when you hear what is absolutely shocking and not said enough, the Royal College of Emergency Medicine saying that 14,000 avoidable deaths are happening every year because of delayed access to emergency care through the emergency pathway. That is just unbelievable, that there isn't a declaration of a national health emergency. And I think that the public are ahead of the politicians on this. They value the NHS. They know that back in 2010, when the NHS was respected, when it was supported politically by the government in power for the previous years, and when it was funded close to the average of the major countries in Europe. At that point, it was less than 18 weeks for over 90% of the population were getting their referral and treatment. Over 95% of people were seen in A&E and treated and sent home, or treated and admitted, not admitted to a trolley, and not waiting 18 months and 2 days before they're admitted. So the older people in this survey who had a higher satisfaction rate actually remember going back a few years when the NHS was supported properly and allowed to succeed because it was funded properly.
I mean, I think there are so many points in here, and it is so complicated, and I have spoken about this a great deal. Just in terms of the money, I mean, we're spending, what, 186 billion or whatever a year, 11.7% of GDP, which is pretty much the European average. There is no doubt, and having worked in the NHS, there is no doubt there is far too much middle management, which the government does understand. Ara Darzi wrote that report, and I used to work for Ara, actually, many years ago at St Mary's Hospital in London. And Ara says that essentially the challenge is utterly enormous. The NHS, he says, is in a critical condition. It has to reform or die. I completely agree about equality of access and keeping it free at the point of need. But it's so big now, and it offers so many services. We're seeing monoclonal antibodies, for example, which cost an absolute fortune. Is there a case to say that we need to look at the core services that the NHS provides? We need to say this is what we're going to do and stick to these core services, because we cannot provide all things to all men when you've got mass immigration into this country, which we know. The population is exploding. We simply don't have enough hospital beds. We don't have enough doctors. And I think we have far too many managers.
Well, you've made a number of points there, so let me see if I can come back at that. I think that Lord Darcy also made the point that there is absolutely nothing wrong with the NHS model and we should support that. He made the point that other countries are either less good or more expensive. There's a comparison with France and Germany and other European countries that actually provide a good health system. But you probably know this, but in France, if we were funded at the same level, I'm not asking for this, but if they were funded at the same per capita level, compared to France, Britain would get about £40 billion a year more for the NHS, and Germany £70 billion a year more. So when the NHS was actually funded at European comparable levels in 2010, it was actually serially assessed internationally as the most cost-effective and best service in the world. And I don't see why we shouldn't strive to go back to that. If you start excluding, if you talk about core services, what isn't core, and you're immediately setting up, if you like, a two-tier service. In some ways, we've got a two-tier service now, because with 7 million people on the waiting list, those that can afford it or those that have to afford it to end their pain or their concern are going privately, and those that can't are just waiting for 18 months for their operation. I don't want a two-tier service. I think that when the principles of universal solidarity, if you like, of a public taxation system, when that's put into effect and the funding of the service is comparable to other major countries, which it hasn't been
I'm honestly not sure that is correct.
Well, per capita, Britain is below Switzerland, is below France, and is below Germany. But what I'm saying is that when we're funded properly, we've been shown to be more cost effective. And when you have waiting lists of 7 million, and when you have theatres closed because the ceiling's falling down, and when you have staff taken away from the NHS and put into private practice, you actually make the NHS inefficient. And of course, it isn't true that we're overmanaged. We might have managers...
Well, it is true. It is true, because let's just look at the Darcy report. Staffing in hospitals up 17%. Productivity has fallen 11.4%. They say A&E departments are deadlier than going to war. I mean, this is a damning indictment of the NHS. You know as well as I do, and I speak to all my friends who are consultants or nurses or whatever, or they work in hospitals, they all say it's falling apart. My lot, and we're all of a certain age, many of my friends who are consultants are saying, I've had enough, I'm leaving. It doesn't work.
Yeah, but I'm saying it isn't working, and if I was on the front line now, I would be extraordinarily stressed about it. But that is the symptom of what has been going on. That is the result of underfunding and abuse.
But the NHS has never had so much money. And the question is, when you've got massive tax rises, we know that there are constraints across the board. We're seeing defence spending rise to 2.5% of GDP. We've got all of these, the Labour government giving unions more money, more increments in their pay. Where is this money coming from?
There's many decisions that have been made over the last few years, and I'm sure you would agree with some of this, that have just been a travesty. Private finance initiative, I think most parties agree that that was a gross waste of money. And what's on the agenda now? Private finance initiative again. Again, you may disagree with this, but there's good evidence that shows that when the NHS is fragmented and taken apart and little bits of it given to private sector, if you like cherry picking, you actually end up with a less efficient NHS. You have a private service that doesn't deliver the same safety measures, and you have money coming out of the NHS, such as in cataract surgery, where the NHS provision at the end of the day is undermined to the point where patients are actually going blind, waiting for routine treatment for glaucoma and retinopathy and so on. So these are bad decisions. These are bad uses of money. Not to mention COVID, of course, where we have £37 billion, etc., going to private companies down the drain.
Again, also mismanagement, I would say, in COVID. Just in terms of that, though, is there an argument to say that when the NHS was set up, and one of our callers said this, they brought together all of the institutions that were there at the time and they ran them all together. Really, if you were to design the a system, you wouldn't start with what we currently have. If you say that the healthcare has to remain free at the point of need and the money follows the patient, surely provision of care, for me, it doesn't matter who gives you that care. That's what Aradazi is saying. That's what the Labour government is saying. If you remember, they say the private sector would build these DTCs, the diagnosis and treatment centres. So I suppose what I'm asking is, should the NHS actually physically own these buildings, or should it be more like a sort of commissioning structure, rather like the BBC, where it can commission from various providers?
A national government, and this government in particular, can borrow money at the cheaper rate, far, far cheaper than private industry. If you end up with health centres and hospitals owned by the private sector, and the diktat is that the NHS has to pay the going rate for rent, you actually end up denuding the NHS of funding. And I know this very well because I helped set up a children's centre in Lewisham, and we avoided PFI, which was then called the lift system. We avoided it by bridging a gap through charitable foundation. But we ended up with that centre owned by the NHS, and it was saving £900,000 a year by not having to pay either the sort of mortgage repayments or the market rent. So there are issues there where a public provision is absolutely cheaper when it's managed properly and when it's delivered properly. And there are real expenses on the private sector, including, for example, the unpaid amount of freely trained doctors, nurses, theatre technicians that go over to the private sector, and the private sector pays nothing and does nothing towards education or training.
I mean, yes, I think Rishi Sunak also got this right, was to double the number of medical school places. I was reading some testimonials of junior doctors who say they simply, despite the fact they qualified in this country, they're extremely well qualified and they can't get jobs, and I don't understand what is underpinning that. And I was listening to a junior doctor who's applied to all of these posts, still can't be employed.
Yeah. Well, I agree with you. That is a real outrage. And of course, there's over 30,000 nurse vacancies as well. And a previous government withdrew the NHS student bursary that was attracting mature students to nursing, mental health nursing, therapies and so on. The fact that 20,000 doctors are facing unemployment this summer is just crazy.
It is.
But looking at some of the reasons why, previous government have been trying to replace trained doctors and trained nurses with physician associates and nursing associates. And well-intentioned some of those people may be, a 2-year training course is not a medical degree, and then they are expected to take on the roles of doctors in terms of diagnosis, ordering imaging, prescribing, and they are not getting the supervision from doctors that they need and deserve. And therefore, you have patient disasters going on with doctor unemployment. You're staring at it in the face, and it's crazy. And I think that this government has to make an urgent decision to say, this is a true emergency. How on earth can we accept 14,000 avoidable deaths a year and not say this is an emergency? And if necessary, we should borrow for it, borrow to invest in the NHS and borrow to turn the NHS round so that it's meeting the needs of the population. And stop this craziness where we've got nearly 4 million people out of work for health-related reasons and waiting lists of 12 to 18 months.
I mean, two very quick points, because time is very tight. Obviously, there also needs to be public participation in this. Obesity is a major problem, as you know, in terms of comorbidities and then driving things like cardiovascular disease. That's one point. The second point is, shouldn't we look at other systems around the world? I was talking to Adam, my producer, today. He's Australian. The idea of having some sort of top-up system imposed. So you've got the provision of care, but there then is a system where you top up that care for whatever consultation you have. Would you welcome looking at some of those other systems around the world?
Well, I'd make 2 points. First of all, I know healthcare in Australia is good. I've got relatives there. I know healthcare in France is good. But I also know that if you have top-ups and you have access to different forms of care through your choice, then you do actually have a 2-tier system. The second point is that if you have a really well-funded public health system, like the NHS has been, and certainly up to 2010 and even 2015, before the wheels started coming off after 5 years of austerity, you still had a private sector, but the vast majority of the public didn't need to go there because they were being seen within 18 weeks. You know, if you had a really painful hip that was keeping you awake at night, not only were you referred for an appointment, but you were actually operated on within 18 weeks if you needed the operation. So when the NHS has been funded properly, that is through progressive taxation. I'm sure taxation could be fairer. I'm sure there should be a wealth tax. You may disagree with that. But if it's progressively taxed and funded through that method, then you don't need top-ups. And you don't need first-class and second-class citizens. You need a system that's funded in a sort of taxation form of social solidarity, and you have a system that's there for everybody from the cradle to the grave.
Really good to talk to you. Thank you for your time, Dr. Tony O'Sullivan, there, co-chair, Keep Our NHS Public and retired consultant paediatrician.